So this is from Dr. Makota, Dr. Wanda Makota. Thank you, Dr. Madra. Sorry, I can't use the Q&A for questions. So this is the question. There are good reporting and data systems for controlled and notifiable diseases. Biosurveillance from several sources are reporting on detection of a diversity of pathogens, for example, in wildlife not linked to disease, mostly detections of viral nucleic acids only. These detections are important to take note of for future prevention of spillover. Is there a way to centralize this data so that it is available to the relevant sectors? A lot of this data is with researchers and not publicly available in real time. And then Dr. Madja, if you need to know more about that question, Prof. Makota can speak to you directly. Thank you. Over to you.
Thank you for that question. It's actually a very good observation in that there's a lot of research, there's a lot of data that is out there that is not properly or centrally coordinated. We do try through our epidemiology section to to collate whatever information that we have and put it on the central database. We are open to further discussions. The main problem, or rather the flag that I need to raise, is to remember that detection of a nucleic acid in research doesn't necessarily mean that there's an active outbreak. It could be that the animal was vaccinated and we have picked that up. Samples were collected shortly after the vaccination, or it's some historic infection that may have persisted. So we need to link that with the clinical picture on the ground, what you as a vet, what you as a paravet, or as the animal owner are seeing being presented to you with the set diagnosis. So we need to just be careful of that. And the other thing that we also need to be mindful of is that some of these diseases are very trait sensitive. And depending on how we capture that information and where we put it and who it is available to, we need to be careful not to disadvantage the industry and put it out there before it is verified and before it is officially reported.
Thank you so much, Dr. Makota. I mean, Prof. Makota, is there anything you'd like to respond? Is there any way you'd like to respond?
Thank you, Dr. Marja. I think that is really also the issue, the quality of the data. But I think one of the things that I feel, so for instance, with the bat research, we identify a lot of viruses in the reservoirs that's just not captured anywhere where people can see it easily. So, and I think there's a lot of other things that's in that same situation. And it can be a completely separate database that doesn't have to imply disease. But I think it becomes important. We saw it with China, that some of the data was lying in research groups for years, sequences that was related to SARS coronavirus 2, and it was just never reported anywhere. And it will be good to have a sort of a national database that government can use, where it's not in a student thesis in 3 years, or and you don't have that data.
True.
No, thank you.
At the moment, that is the only question. It was a very clear and thorough presentation, so thank you. Is there anything further you would like to add that you perhaps didn't cover in your presentation?
Not at the moment, no, thanks.
Thank you so much. I'll just check if there's anyone else, but it looks like we are good. Yancy, over to you.
Thank you, Debbie. I want to ask, actually, now that we're seeing lions there, there was this change in legislation that classified wildlife as livestock. Is that a good thing? I had my doubts about it, but what do you think is the purpose of that legislation?
Sure. I'm now way out of my depth in responding to that, but I think the intention was to separate the responsibilities between agriculture and environmental affairs when it comes to farming and food producing animals. So you'd find that some of the wildlife has been classified as, or has been migrated to agriculture because there is a potential of them being used as a protein source. Whereas whatever remains with environmental affairs then gets governed by conservation and trying to retain that genetic material. But like I said, I'm completely out of my depth. My colleagues from animal production would have a better opinion on that. Okay. Disease-wise, it doesn't matter whether you are in environmental affairs or agriculture. If you have a disease, it becomes animal health's responsibility to manage that. We are managing infections in wildlife. We have TB in wildlife that we are managing together with environmental affairs and with the nature reserves that are involved. So when it comes to diseases, they don't see the legislation, and unfortunately for me, it all falls on my shoulders.
Okay, thank you very much for that answer, Dr. Maja, and thank you for your presentation.
Only a pleasure. Thank you.
Right, before we go on to the next speaker, I just want to ask Prof. Markato something. You know, the petting zoos or the petting ranches that are there for big cats, for cheetahs and lions, could that be dangerous from a spillover point of view?
You can't say no completely, but what we must remember, these animals are probably in that environment for a long time. So they're sort of in lockdown together. So if you introduce new animals and it's an open environment and you don't have good biosecurity and good hygiene in those areas, obviously, yes. But overall, it's probably a lower risk than some of the other interfaces.
Right. Yes.
Yes.
Okay. No, that is interesting. Thank you. I just want to remark that I see the NSDF award trophy behind you. And that reminds me to tell everybody that you are a recipient of an NSDF award.
Yeah, it's a very nice trophy, so thank you.
Can see the end, one more.
Okay, Debbie.
I just wanted to get that in because it came in late. So I just wanted to get it in for Dr. Maja. Michelle Miller asks, how do you manage the presence of a pathogen without the presence of disease? And then over to Dr. Maja.
Sure. That is very difficult. And I'm hoping that we don't get that situation presenting itself regularly or frequently in the country. But it makes disease control very difficult. And again, depending on what disease we would be talking about, if it's one of those control diseases that we really need to eradicate, we will go over and do further investigations, further investigations in the area surrounding it. But if it's a notifiable or none of the listed diseases, we will just take note and keep an eye on the situation. Mm-hmm. I don't know if I've answered that sufficiently.
Okay. Gabriela Mancune says, when it comes to keeping pets healthy and disease-free in many communities, there's no access to vets. What is the department's role in that? And that's the DAL-RRDS.
If I could answer that, in the last 3-4 years, we have introduced primary animal health care as well as compulsory community service for graduating vets. And that was in an attempt to address exactly that concern, that access to veterinary services, especially for pets, is fairly lacking. We, at the moment, only have one school that trains veterinarians, and we have about, say, 120 graduating on an annual basis, some of who then go back to their home countries and leaving us with, say, plus minus 100. Putting them in 9 provinces means just about 11, 12 vets in provinces. You can clearly see that's a drop in the ocean. There's only so much that we can afford to do in providing that service. But fortunately, there's other service that is provided, especially for pets, by welfare organizations. I won't mention them. There's quite a number of welfare organizations that are providing either free or very reduced rate veterinary services for pets. And if I could also add, for controlled diseases that do occur in pets, rabies comes to mind. Government does offer regular vaccinations for free in communities that are regarded as hotspots, where we need to bring the infection rate down. So some of these activities we do have initiatives for.